Hi, this is Dr. Martina, your sexuality expert and online sex therapist. I was getting out of the shower the other day and I was looking at my aging body and my worries are starting to come up. I was worried about my eyesight. Is it going to get worse? About my sagging breasts. Are they going to get lower? Are my ankles are going to hold out? Is my skin going to get more wrinkly? So all these worries that we have, that we think about when we look at our body and when we're aging. But you know what? There's one thing I'm not worried about, and that is my clitoris. She is a bundle of exciting nerves with one loyal mission, that is to give me pleasure, and she will not change. She is a forever and always. So with that in mind, I decided to put this little video together in honor of her, but also for you, to teach you a little history on it, a little necessary anatomy, a little care and purpose of it, so you can have a more grateful and thankful relationship with your clitoris, and you can learn more about her, because the more you know about her, the better your sex will be. So this is for all you women and for the men who love women. So here we go. Enjoy.
I wanted to see who discovered the clitoris, or at least claimed to have done so. Reinaldus Columbus, a lecturer of surgery at the University of Padua, claims to have discovered the clitoris in 1559. He concluded, quote, "If it is permissible to give names to things discovered by me, it should be called the love or sweetness of Venus." Gabriel Fallopius, his successor at Padua, was a highly distinguished anatomist who contributed significantly to the early knowledge of the reproductive organs, as his name is Fallopius. He insisted that he, Fallopius, saw the clitoris first and that everyone else was a plagiarist. A semblance of sanity was restored when Caspar Bartholin, a renowned 17th century anatomist from Copenhagen, argued in turn that both Fallopius and Columbus were vainglorious in claiming the invention or first observation of this part, since the clitoris had been known to everyone since the 2nd century. By this, one assumes he means known to male anatomists. It is safe to say women had discovered it a good while before that. First, I wanted to show you a life-size structure of the clitoris. This way you can see that the legs of the clitoris are the proximal portions of the wishbone's arms. The clitoris is a structure with 3 sections: the glans, the shaft, also called the body of the clitoris, and the base, which is also called the legs and bulbs. The part that is most visible when you spread the vulva is the glans of the clitoris. Glans means a small round mass or body or tissue that can swell and harden, both of which apply to the glans clitoris. Whatever the size, all glands are bundles of nerves in the approximate amount of 8,000 nerve fibers. The clitoris comes with a hood to protect the never-ending rich tissue of the clitoris from unwanted stimulation. This hood can vary considerably in size and fleshiness, so don't be alarmed. The shaft extends internally from the glans. It has relatively few nerves, but it is threaded through with thousands of blood vessels, allowing it to swell during arousal and push the head ever higher, inflating to twice the size of the unaroused clitoris. From the shaft extend the erectile corpora cavernosa and bulbs. The lower 2 sections, the shaft and the base, or the legs, are the structure's mass and height beneath the vulva's skin. Nature's perfect design anchors the shaft to the pubic symphysis with the twin legs. Remember, the shaft is only partially visible, but you sure can feel it. So let your touch follow the legs of the clitoris all the way to the base of it, where they slope towards the vagina. It is much easier to feel the clitoris than it is to see her. One of the many gifts of the clitoris is her lack of interest for estrogen, and therefore it does not care if you're taking birth control pills or estrogen replacement therapy. It will not atrophy after menopause the way the vagina can. It will remain unmodified in the adult, and the woman retains this erotic independence all her life. We have a body full of organs that perform up to 500 tasks a day. I am delighted to tell you that the clitoris is also a large and complex organ, but with only one task, only one function, which is to provide sexual pleasure. With more nerve endings than any other part of the human body, male or female, more than fingertips, tongue, anal, and twice as many as the head of the penis, the clitoris is more than equipped to do the job. But I guess it is just like a brand new toy. If you don't know how to play with it, it will only remain in the box, not bringing any joy or laughter or orgasms. Which brings me to the care of the clitoris. The clitoris will respond to digital manipulation or use of a vibrator, oral stimulation, or merely running water directly on her, the use of your partner's thigh, or your favorite pillow. She does not discriminate, as long as you touch her with care and respect. She is the center of female sexuality and the powerhouse of the female orgasm. One thing to notice is that when the body is not in an advanced arousal state, the clitoris may be too sensitive to touch. The clitoral hood provides additional protection, and it can be used like a mitten to indirectly touch the clitoris in case the sensitivity is still too much for caress. The mouth and tongue provide direct clitoral titillation that is softer and gentler, and saliva acts as a natural lubricant. And now we're coming to the million-dollar question. What do women want? Well, you are going to have to ask them. That's the conclusion of an extensive study to analyze the diversity of female sexual pleasure. Debbie Hebernick at the Indiana University and her colleagues asked 1,055 heterosexual women in the U.S. to answer a questionnaire that covered, amongst other topics, their preferred pattern of genital stimulation. The participants ranged from 18 to 94 years old. More than a third of women reported needing clitoral stimulation to reach orgasm, while less than a fifth reported that intercourse alone was sufficient. An additional 36% said that clitoral stimulation wasn't necessary, but made for a better orgasm. When asked about their ideal techniques, 2/3 preferred direct clitoral stimulation. Of those that preferred indirect stimulation, the majority preferred touching through the skin above the hood, while a smaller number preferred touching through both lips pushed together like a sandwich. Fewer than 10% of women enjoyed stimulation to their mons pubis, the squishy area of tissue above the pubic bone. Around 5% preferred it when their partner avoided the clitoris altogether. As you can see, women's preferences in the bedroom vary dramatically, and a lot of time the woman herself doesn't know what she likes. With that said, we must take a look at the frequency with which the clitoris fails us. The Kinsey Report on Sexuality found that 36% of women in their 20s were pre-orgasmic, while for those in their 30s or older the number dropped to 15%. More recent studies have shown smaller numbers of pre-orgasmia amongst women, but the older women still remain more orgasmic as their younger counterparts. So the power of knowing your own body does translate into greater satisfaction, but it also takes time to mature such knowledge.
So, I understand that the size, the design of the clitoris is can make it a little difficult to get to know her. And with that in mind, I want to leave you with something that Natalie Enger wrote in her book, Woman. She speaks of the assumption that the design of the clitoris is an encouragement for its bearer to take control of her sexuality, which is something, if it's done seriously, can change the whole experience and perspective of female sexuality. Now there's something to think about. I'll see you next week.